Okay, we are all about remote healthcare jobs today. I have some entry-level, mid-level, and remote jobs for nurses. Hopefully something for everyone looking for a healthcare job you can do from home. I'm going to start off with the entry-level healthcare jobs, and the first one I have comes to us from Assembly Health. So the first thing we need to do is land on their careers page and scroll down to the bottom. That's where they have this particular job description. So this one is for a medical billing call center representative. It's full-time remote. You can do it anywhere within the United States. I did not see any location restrictions. And this is your typical call center position. You're going to do a whole lot of phone work in this job. You'll greet patients in a friendly and positive manner, discuss and answer customers' questions with a goal of one-call resolution, update confidential information and insurance billing, and process credit card payments. You'll also work with collection agencies to update and provide accurate information and respond to attorney requests for balances and correspondence. And to qualify, they prefer you have proven experience answering high-volume calls in a call center or other customer support role, and it's a big plus you have previous healthcare experience. And when it comes to the salary, down here at the bottom of the job description, they tell us they'll pay you anywhere from $17 to $20 per hour. So our next entry-level healthcare job is with MedWatch LLC. I've never heard of this company before, but they've been around since 1988, and they're based out of Lake Mary, Florida. They're a national care management and medical cost containment firm. They're looking for an operations support specialist to work full-time remotely anywhere within the United States. And in this job, you'll be responsible for administrative duties, including group configuration, special projects, and operations-related support functions. So yep, you're going to do a whole bunch of admin work in this position. You'll maintain an understanding of MedWatch products and services and objectives. You'll be the resource for teams setting up new groups and review new group setups in MedWatch system with efficiency and accuracy. You'll also audit monthly renewals for accuracy and timely distribution, and communicate with clients and internal staff via phone and email. You'll assist the accounting department in resolving outstanding invoice issues and provide support to other areas of the company as requested or assigned. So for this job, you need to be proficient using Microsoft Office applications. You're able to learn and utilize internal applications, and you have strong interpersonal and communication skills. They'd also like you to have knowledge of the insurance, self-funded, and stop-loss industry. You're self-motivated, a problem solver, and it's a plus you're bilingual in English and Spanish, and that's just a plus, it's not required. They prefer you have some college or higher education, and they'd like you to have about 1 year experience in a customer service role. And like I always say, if you ever dealt with the public in any capacity, that qualifies as customer service. They're not saying it has to be related to the healthcare industry. And we can see right here on the job description, they tell us they'll pay you between $17.50 and $21 per hour. Another entry-level healthcare job is with the company Rethink First. So Rethink First is a behavioral health company, and this job is for an RCM support specialist. It's full-time remote. However, it looks like they're only hiring remotely if you live in one of these 32 states you see on your screen right now. So yeah, this is an entry-level position where you'll provide quality customer service while efficiently handling inquiries, customer complaints, and or billing questions by phone, email, or chat to resolve client inquiries related to ABA services. And you do all that while maintaining strict HIPAA-compliant confidentiality with all client-related data. And what they want from you is an associate's degree or higher level of education, and you must have strong customer service background, and they'd like you to have knowledge of ABA insurance policies and practices. And when it comes to that part, what I recommend doing is a quick internet search. Get as familiar as you can with ABA insurance policies and practices. They strongly prefer you have experience using Salesforce. They strongly prefer you have prior experience managing the accounts receivable process for clients, and they also prefer you have experience with software programs such as Tebra, Azalea, Central Reachability, and Steady, and it's desired you have experience using SharePoint. And I'm just going to scroll around to see if they tell us how much they pay, and I don't see it anywhere on this job description, but based on my experience looking at similar roles, I have a feeling this job could pay anywhere from $17 to $19 per hour, but I can't guarantee that. You'll have to work out your salary with them. So another entry-level healthcare job is with Nabby Health. This one is for a credentialing and back office operations coordinator to work in the billing division. So this job is full-time remote anywhere within the United States, no location restrictions, and this is a very administrative heavy kind of job. You'll support revenue cycle operations, provider onboarding, and administrative workflows that enable clinicians to deliver high-quality care at scale. This role is ideal for someone who's detail-oriented, systems-driven, and excited to help build build operational processes in a growing mission-driven healthcare startup. So you do some billing and revenue cycle management, credentialing and provider enrollment, back office administrative operations, as well as compliance and communication. They'd like you to have about 1 year healthcare administration experience, as well as prior experience with medical billing, insurance claims, denials, or RCM workflows. You're also comfortable with EMRs, billing software, spreadsheets, and Google Workspace, and you're able to work independently in a fast-paced, fully remote environment. And they have some preferred qualifications. They're just preferred, not required. Read through them. If you meet any of these preferences, make sure to include them on your resume. And then, of course, you need your typical soft skills. And as far as the salary, I'm just scrolling around. I don't see it anywhere on this job description. Let's take a quick peek at the application. And scrolling through this application, I don't see the salary indicated here either. But based on my experience looking at similar roles, I have a feeling this job could pay around $20 per hour. But there's no way I can guarantee that salary. You'll have to work it out with them. Okay, so now moving into the mid-level remote healthcare jobs. The first one I have is with Assembly Health. And if this company sounds familiar, it's because I shared an entry-level healthcare job. So again, we're going to land on their careers page and we're going to scroll down to the actual job I'm sharing. This one is for a medical billing call center team lead. It's full-time remote anywhere within the United States, no location restrictions. So what you do in this job is act as the primary escalation point for a call center staff, answering escalated phone calls from the call center offshore team, and assist in educating the offshore call center staff. You'll update patient demographics, answer patient calls and questions, and update and bill insurance. You'll take credit card payments and resolve any concerns and issues on patient accounts, and work with collection agencies for requests to remove from collections. You'll also respond to attorney requests for balances in correspondence, as well as do some updates and bill insurance. They tell us it's a plus you have experience using NextGen and you have a medical billing background. You also have excellent communication skills as well as a professional demeanor, and you're able to work under tight deadlines. And scrolling down this job description, they tell us they'll pay you between $21 and $23 per hour. Next up, we have a medical records coordinator job with the company Spring Health. Now, this is a temporary position. However, I have no idea how long this assignment will last. But they do tell us this job has the opportunity to extend or become permanent full-time based on performance and or business needs. Now, they do want you to have some flexibility as far as what your shift might be, and they want you to be able to work 1 weekend per month and at least 4 holidays per year. But they do have 4 shifts from which to choose, so you can work from 8 a.m. to 4 p.m., 9 a.m. to 5 p.m., 10 a.m. to 6 p.m., or noon to 8 p.m. Eastern Time Zone hours, but you don't have to live in the Eastern Time Zone. Just translate your local hours to those hours. So what you're going to do in this job is upload records requests and patient authorization forms, including processing medical record requests and provider letters. You'll build relationships with providers, patients, and internal teams for the purpose of medical records management. You'll assist members with mental health leaves and accommodations requests and be the liaison with provider and third parties as needed. So that's the gist of what you're going to do in this position. They have some more details. If interested, read through the details. They'd like you to have at least 1 year experience in a similar role, as well as advanced understanding of medical terminology and HIPAA. You have experience with Adobe Acrobat, Google Sheets, Google Docs, and Microsoft Office applications, and you're very comfortable adopting new technologies and platforms, and you're efficient in tech-related tasks. And you probably notice the salary here. They tell us they'll pay you between $25.13 and $29.49 per hour. Mayo Clinic has an opening for a pre-certification and authorization rep. This job is full-time remote. You can do it anywhere within the United States. I saw down here they tell us this position is 100% remote. Individual may live anywhere in the U.S. So this is an intermediate level position, and you'll be responsible for resolving referral, pre-certification, and or prior authorization to support insurance-specific requirements for all commercial, government, and other payers across hospital, ED, and clinical and ambulatory environments. You may also do some pre-appointment insurance review and denials recovery functions within the patient access department, and process pre-certification and prior authorization for workers' compensation and third-party liability. You might also manage care and HMO accounts, as well as work assigned registered denials for government and non-government accounts. So for this job, they want you to have a high school diploma or a GED and at least 2 years relevant experience or a bachelor's degree. They'd like you to have general knowledge of healthcare terminology and CPT ICD-10 codes, as well as basic knowledge of and experience in insurance verification and claim adjudication is preferred. And that part is just preferred, it's not required. Knowledge of denial codes is preferred, as well as knowledge of and experience using an Epic RCM EMR system is also preferred. And they also prefer you have Healthcare Financial Management Association certification. And those last 3 things I just read are just preferred, they're not required. And they tell us right here on the job description they'll pay you anywhere from $21.91 up to $34.27 per hour. And scrolling down just a little bit more, I just want to tell you your schedule, which will be Monday through Friday, 8 a.m. to 4:30 p.m. with a 30-minute lunch, or 8 a.m. to 5 p.m. with a 60-minute lunch. Our last mid-level healthcare job is with City of Hope. This one is for an intake supervisor. It's full-time remote anywhere within the United States, I strongly assume, because they're not indicating any location requirements. And right here we can see they tell us they'll pay you between $25.80 and $42.53 per hour. You work Monday through Friday, 8 a.m. to 5 p.m. Pacific time zone hours, but I'm pretty sure you do not have to live in the Pacific time zone because this job is fully remote. So you'll be responsible for providing oversight to the new patient experience records coordinators to lead the function of intake and medical records. You'll oversee the function of intake and medical records to ensure procurement of medical records on new incoming patients prior to their arrival to their first appointment, and also ensure proper documentation for follow-up, tracking, and reporting purposes. This role will require support to the team by proactively and creatively solving issues, overseeing workflows, creating process improvements, ensuring quality outcomes, and setting goals and expectations for performance. They'd like you to have a bachelor's degree or equivalent work experience and at least 2 years leadership experience. You're an excellent communicator, you're a problem solver, you have knowledge of Microsoft Office Suite, and you have a pretty decent internet connection. And that pretty much sums up this mid-level remote healthcare job. So if you're already a nurse, I have a couple opportunities for you. Fuse Health has an opening for a registered nurse. This job is fully remote in the United States. However, you do need an active, non-restricted, compact state nursing license with primary state of licensure in one of the following states. And they have several states listed here, so hopefully your state is listed. So you work Monday through Friday from 12:30 p.m. to 9 p.m. Eastern Time with a rotating Saturday schedule of 9 a.m. to 5:30 p.m. Eastern Time. And what you're going to do in this position is support the FuseRx Central Operations Telehealth Care Team by providing remote outreach to Medicare members. This role focuses on ensuring member compliance with the new STARS measure and confirming successful emergency department discharge. Additional responsibilities may include closing other HIDUS measures, all while delivering compassionate, high-quality virtual care. So that means you'll provide remote patient care and support through telehealth platforms and conduct virtual patient assessments, including reviewing medical histories and current symptoms. You'll accurately assess and document patient conditions, histories, and care interactions, and educate patients and their families on medical conditions, medication adherence, and self-care practices. And they have more details. If interested, go ahead and read through the details of what you might do on a regular basis. You need a Bachelor of Science in Nursing degree and an active, non-restricted, compact state license from one of the states we already talked about, and they want you to have about 2 years experience as a registered nurse and 1 to 2 years experience in a remote healthcare or telehealth setting. And scrolling down a little bit further, they tell us they'll pay you anywhere from $38 to $40 per hour. Now, I just noticed this right here. Fuse Health is unable to hire individuals living in one of the following states, and they have several states listed here, so hopefully you do not live in one of these states. So our last remote healthcare job is for all of you who are already an RN or an LPN. So the company MedWatch has several case manager positions as well as a case manager assistant position if you're an LPN. So let's take a quick peek at one of these case manager positions. So it's full-time remote. I'm pretty sure anywhere within the United States. You do need to be licensed in all 50 states, and that includes states not included in the compact license. You're also a registered nurse. That means you have a current active and unrestricted license in state of current practice and residence within the United States or its territories. And they prefer you have a bachelor's degree in a health-related field. They also prefer you have about 7 years varied clinical experience. So as a case manager, you will manage an individual caseload using the case management process in order to meet the needs of MedWatch LLC customers and consumers. This includes, but is not limited to, authorization of services, review of treatment plans for medical necessity, standards of care, and ongoing communication with all members of the healthcare team. So that pretty much sums up what you're going to do in this position. They have a whole bunch more details. If interested in this job, go ahead and read through the details of what you're going to do on a regular basis. And as we scroll down towards the bottom of the job description, they tell us they'll pay you between $72,000 and $81,000 per year. So that's the gist of the case management jobs. Let's take a quick peek at the case manager assistant position. This is a full-time remote job. I'm pretty sure you can do it anywhere within the United States. You need licensed practical nurse or medical assistant nursing assistant certification. Licensed practical nursing education is preferred, and you have basic computer skills. And they prefer you have about 5 years varied clinical experience or 3 years in a specialty field. So you'll perform all functions under the direct management and supervision of the RN case manager, performing necessary functions using the case management process in order to meet the needs of the MedWatch LLC customers and consumers. So you'll do some authorization of services, review of treatment plans for medical necessity, standards of care, and ongoing communication with all members of the healthcare team. And they have more details. If interested, read through the details. And scrolling down a little bit further, they tell us they'll pay you $23 to $27 per hour. So we just went over several remote healthcare jobs, some entry-level, some mid-level, and some if you're already a nurse. And you know what, guys? Make sure to check out the pinned comment. I'm going to put the copy-pastable link for all of these jobs in the pinned comment. So hopefully one of these jobs works out for you. But if you're looking for a work-from-home job that is not in the healthcare field, you can find some in this video right here. Thank you so much for visiting. I truly appreciate your support, and I'll meet you on the next job lead.